With COVID-19 infections on the decline and South Africa on lockdown level 2, Health Minister Dr. Joe Phaahla joins me in studio to speak about government's updates and the response to the vaccine rollout. Thank you so much for your time, Dr. Phaahla. We really do appreciate it. Let's start off with how the vaccine rollout is going. We know a target has been set for 40 million by December. Where are we and will we meet this target?
Well, at this stage, I can say again that in terms of the various parameters of our campaign, we are still on course in terms of being able to say to South Africans that we have the necessary capacity. In other words, in terms of the vaccine supply stock, we are well stocked in terms of that. In terms of vaccination capacity, we also fully capacitated with more than 3,000 fixed vaccination sites, but also including mobile sites and also what is called pop-out or pop-in, whichever way. In other words, vaccination stations which pop into the malls, into taxi ranks, and into various other areas where people are congregated, mobiles into occupational sites like in the mines, in the farms, in various factories. Now, in terms of whether the uptake will be enough for us to reach the 70%, let me just explain again, just to put it in context, that the 40 million target, it's a 40 million target in terms of the total South African population of 60 million. But we know that our vaccination at this stage is focusing on the adult population. So that's why we often emphasize more on the percentage of the targeted population. Now, the current targeted population, it's 40 million plus minus, just between 39 and 40 million of the above 18 South Africans. So to reach 70% of that, of course, we still need to reach at least 27 million South Africans. Now, in terms of where we are as of yesterday, in terms of individuals who have had at least one jab, we are just over 12 million, which means that we still short. We're just over 12 million and 150. So we still need another 15 million people to come forward to take the vaccination by December, where our wish is that these 15 million people will be able to come forward or be able to be reached by at the latest by end of December or even earlier by around the middle of December. That's our hope. As I said, we do have the capacity, we do have the vaccinations. In terms of those who are fully vaccinated, either with one J&J vaccine or two Pfizers, with that, we're just under 8 million, which is at just under 7.9 million South Africans. So we still have a long way to go, but I want to emphasize that we do have the capacity.
Yes, Minister, let's speak about the fact that you have the capacity. You say you have the vaccines, but there's a huge issue around vaccine apathy and also the fact that there's a lot of hesitancy. And you were expecting certain numbers, especially in the cohort 18 and above, and you aren't seeing those numbers. What is government's plan to get people to get vaccinated? Because if you say that by mid-December or end of December you want 40 million people vaccinated, you have 3 months to go to reach that target.
Well, this is going to take a certain amount of work from government. I accept that. But I think we must also, as South Africans, just accept the fact that a government alone cannot achieve this. I would say that the fundamental task which only government can achieve is to make sure that we have the necessary capacity that we have been able to achieve. But to make sure that people do come forward and take the vaccine, it takes all of us, all of government, all of society, all of us working together. And that's why we're talking to various sectors, leaders of various components of society, business, civil society, political parties. We're appealing to everyone. We're also trying to make sure that our communication in all languages, in all stations, can reach all South Africans with a message emphasizing that this is the only tool currently available which can help us avert another disaster in terms of so many people dying. As we know, we currently have more than 86,000 people who have already succumbed, and so many who have gone through the health facilities. And this is the message which we're taking forward to say there is ample evidence which shows that even currently, amongst the people who get admitted with COVID-19 in hospitals, only 20% are those who have been vaccinated, and even less of those who are vaccinated end up in ICU. So this is the message. We accept the fact that we must lead as government, but we must also make sure that we encourage all components of society to come with us if we are to achieve this goal.
Sure, Minister. We're running out of time, but I just need to quickly ask you with regards to vaccine stock and availability and arrivals of perhaps more specifically the Johnson & Johnson vaccine, because we know, for example, the Northern Cape is lagging behind in terms of vaccines administered because they solely base their vaccine rollouts on Johnson & Johnson. What is our stock currently, and how much more are we expecting to arrive in terms of Johnson & Johnson?
Well, what I can say to you, Heidi, is that we're expecting more Johnson & Johnson, but at the current moment, we do have adequate stock of both Johnson & Johnson and Pfizer vaccine. So even, the Northern Cape is being supplied, and all other provinces. There are a lot of people in society who prefer the Johnson & Johnson because it's a one-dose full vaccination. So we are receiving on a weekly basis the stock. We still have a lot of balance of the J&J vaccine, which is coming through. And at this stage, we're quite satisfied with the delivery. And I can assure you that all provinces, including the Northern Cape, are receiving both Pfizer and Johnson & Johnson.
Okay. Minister, speak to us about the status of the Director General, Dr. Sandile Buthelezi. Is he still on leave, and when can we expect him to be back in office?
Well, what happened is that I did mention earlier on when Dr. Buthelezi took leave that there were some matters which he needed to respond to. And these were matters related to the Digital Vibes fiasco. So the DG then was given time. He asked for time to prepare himself to respond to a number of questions in that regard. He did. And subsequent to that, a decision was then taken that he should be put on suspension. It's a precautionary suspension pending answering to formal charges relating to what was found by the ICU as his role in terms of that fiasco of Digital Vibes. So at the present moment, his leave was, he completed his leave for 2 weeks. And at the end of that, when he submitted his responses, the decision was then taken that he should be given a precautionary suspension while he's going to be given a chance to formally respond to the allegations contained in the SIU report relating to his role. So that is the current status, that he is on precautionary suspension.
So when was the DG put on precautionary suspension?
That would be last week, Thursday.
Okay.
Last week, Thursday. That's when he was put on precautionary suspension, yes.
Okay. Minister, just quickly speak to me lastly about the fact that there has been allegations of corruption in the Department of Health, especially linked to Digital Vibes, while the DG has been placed on precautionary suspension and the former minister decided to excuse himself. Are you not worried about a deeper level of corruption within the Department of Health, especially during a pandemic, and how people should be trusting the Department of Health in its entirety, yet there are allegations of such corruption?
Well, I think we've been very forthright, led by our president, President Ramaphosa, that this administration has to do a lot more to fight the scourge of corruption. A lot of progress has been made in that regard. And also, even with regard to the digital vibes matter, you would remember that it's the president who authorized the SIU to go deeper into this matter. They did present him with a report, and we are now acting on the basis of that report. So if there is any other allegations of any other corrupt activities within the department, we are really ready to make sure that we deal with it, that nothing will be swept under the carpet. So at this stage, all that what we know, we deal with. Anything else which we come to know at the later stage, we will definitely deal with.
Okay, and then just lastly, Minister, speak to us about the fact that COVID-19 numbers are on the decline. There are some provinces that are a little bit of concern, but officially, is South Africa out of its third wave? And are you satisfied with where the COVID-19 numbers are at the moment?
We are quite encouraged that it's going the right direction. Over the last 7 days, the last 14 days, it's been a constant decline. As of yesterday, the national positive number was below 2,000, just over 1,600, with most provinces actually reporting infection rates of less than 400, some even reporting just 2 digits of infections, some as low as less than 20 positive specimen, and the overall positivity rate also approaching the 5%, which is regarded by the World Health Organization as a form of stability. So we're going in the right direction. There's just one province currently which is still worrying us, which is the Northern Cape, with still above 20% of positive rate. As a country overall, we are progressively getting out of the third wave. Almost all nationally as a national direction, we are exiting. We're just about to exit the third wave. There's still the coastal provinces of Western Cape, KZN, Eastern Cape, and then Northern Cape also being of worry. But the other 5 provinces have actually exited. And as a nation, we are just about to exit the third wave, so we're going in the right direction.
Great. Thanks so much for your time, Health Minister Dr. Joe Phaahla. We really do appreciate it. And the breaking news that's just coming in, the Director General of the Department of Health has been placed on precautionary suspension after being on leave for 2 weeks. He had asked for leave to prepare certain questions and answers as there was allegations of possible involvement linked to that Digital Vibes contract that the SIU is investigating.